A vaccinee has to fill out a health declaration form and will undergo screening first before being inoculated against COVID-19 as part of the vaccination protocol. The Department of Health says they won't do COVID-19 testing prior to vaccination as part of the screening. The DOH gave the reaction after the reported death of a 47-year-old female healthcare worker who was vaccinated with CoronaVac's CoronaVac vaccine on March 4.
Those who report exposure or show symptoms of COVID-19 are actually not recommended to be vaccinated, and they're actually requested to send home. So at this point in time, there's no changes in our protocol. And also, if you will look at any other country in the world, we don't do testing prior to vaccination as part of the screening.
Based on the investigation of the National Adverse Events Following Immunization Committee or NAFIC, the healthcare worker has comorbidities, diabetes, hypertension, and bronchial asthma based on her health declaration form. NAFIC Vice Chair Dr. Romel Lobo also says she died of COVID-19 infection and not due to COVID-19 vaccine. Based on her health record, she tested positive of COVID-19 last 2020 and also on February 2022. But then she tested negative of the virus last February 23. She was asymptomatic on the day when she was inoculated on March 4. She tested positive again for COVID-19 last March 8 but refused to be admitted. It was on March 10 when she was admitted. On March 13, she succumbed to COVID-19 infection.
The patient might have been exposed to a individual that she had encountered, and then she might be incubating or having asymptomatic symptoms at the time that she was vaccinated. She developed the symptoms after vaccination. So as I've said, the vaccine does not have anything to do with the infection.
The DOH says with these findings, there's no reason to suspend CoronaVac inoculation.
It's very clear from the report, there's no reason to suspend our vaccination program, as first, the vaccine is not what caused the death of our healthcare worker, and second, as DOH and FDA has continued to emphasize, the benefits of vaccination continue to outweigh the risk of us getting COVID, particularly severe COVID-19.
According to Food and Drug Administration Director General Eric Domingo, although one has been vaccinated, it does not give an assurance that a person will not be infected with COVID-19.
During the first few weeks after you're injected with the vaccine, you have no protection. If this is the time that your immune system is trying to develop. So talagang expected, no, na first few weeks after vaccination, your risk of developing COVID-19, getting the illness and getting severe illness or possibly dying from it is the same as a non-vaccinated person.
The FDA has already informed Sinovac Biotech about the case and asked if there are history of similar cases in other countries. Experts are also advising COVID-19 survivors that they have to wait 2 to 3 months before getting inoculated. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
CGI Free Store. Get what you need, not what you want.